It's my pleasure to welcome this meeting of Hertfordshire's Health and Wellbeing Board today on the 4th of December. I have a formal announcement which has to be made in light of the COVID influence. Due to the coronavirus pandemic, the Council will be holding this meeting electronically in accordance with the relevant regulations. Members of the public may also attend this meeting in an electronic capacity, and there is a link on the Council's website for them to do so. Members of the Council are asked to keep their microphones switched off until called to speak, and to switch their microphones off once they have finished speaking. Cameras may be left on throughout the meeting if members wish. If you experience connection or other technical issues, it may help to switch your camera off. Cameras should be switched on if and when speaking in the meeting. To indicate a wish to speak, members should use the raise hand function. Use of the meeting chat function is exclusively for voting. At the end of the debate on each item of business, there will be a vote. Members should vote using the meeting chat function by indicating for, against, or abstain. I will declare the result after each vote. I do apologise. We tried to get round this rather long-winded formality last time, and we have been caught out and told off. Breaks of at least 15 minutes will be held every 2 hours and will be taken after a speaker in the debate has finished speaking. If we are voting, the vote will be concluded before the break is taken. Other breaks will be incorporated as appropriate. Thank you very much. So that's the very formal bit. So feel free to have your cameras on or off as you wish, and either we will be informed whether we are struggling with reception and the meeting, and as we go along. Right. Ed, I can see you on camera, which reminds me that you have rejoined us after a brief interval reorganising local government, and it is a welcome return. We thank Tom for his significant contribution for 3 months, and who knows, we may see him back again at another time. But Ed, thank you, and for bringing your support here this morning. Elliot Howard-Jones, welcome. Now, is Elliot actually with us yet?
Joining us
shortly. Show yourself if you are.
He's in another meeting, East North Hearts Integrated Care Partnership.
He's a little bit late, isn't he? Yeah, that's right. Okay, no worries. Elliot is replacing Claire Hawkins on the Health and Wellbeing Board. And we look forward to his contribution over time. And can I say thank you so much to Claire for all she did at HCT in her role as Chief Executive and before, and her contributions here at the Health and Wellbeing Board. We are grateful. I've had apologies from David Lloyd. Now, Paul is here, but wishes to, or will be shortly. Paul needs to leave at 10:45, so I'll be more than happy to hear from Paul on any of our agenda items before that time. Richard Cassidy will be 50 minutes late for the meeting. Richard, Chief Executive of East Hearts, and we look forward to him joining us later. Just a comment from me. I am more than aware that we are at the peak for our agencies right across health, social care, the voluntary sector, and in a sense, our wider public in the middle of the second peak of the pandemic. So I do not feel that we necessarily need to extend this meeting longer than we need to. Many of you need to get back to sorting out the day job, rushing from this desk to the kitchen and back to your desk again. Seriously, I am aware that we have got vaccination going on and the planning for that, which has landed only just this week. I am delighted that the vaccination has been approved, the Pfizer recipe is going to be landing with us very shortly, and perhaps somebody can update during this meeting on that. We've also got the rollout of rapid testing, and I'm sure Jim will be updating us on that shortly, and others may wish to. But there is an awful lot going on, as well as, of course, in our hospitals, very much at the peak in terms of those who are coming in at the moment, and we will have updates on that. What I will add is that whilst agenda item 6 is for an update across all of our agencies, if you have updated us in earlier parts of this meeting, we do not need to repeat ourselves then. And that is my steer. And perhaps, Ed, if you can keep, as part of summing up at the end of agenda item 6, keep a track of some of the key announcements during this meeting and just sum them up at the end of 6. That would be really helpful. Thank you. Right, so we've got the minutes from our previous meeting of the 2nd of October. I'm just going, oh, right, we have to agree by chat the minutes. So if you believe the minutes are accurate and can be agreed, will you please type agree in the chat function so we can note that formally. There we are. Thank you very much. So it's an absolute pleasure to have all of those agreements flashing up the side of the screen like that. Good. Is there anything that anybody wishes to raise from those minutes that you don't feel that is covered in the meeting today or hasn't been picked up before that meeting, before today's meeting? There we are. That's fine. Thank you. So we'll take those as read, and at some point I will sign those minutes. Thank you very much. We now move to public questions, and we received a question from Sandra Barr, who is a carer for her severely disabled son. And she wanted to ask a question of the Health and Wellbeing Board, which is absolutely her right. I think she asked if this was an appropriate place to bring it, and I thought absolutely. Mrs. Barr is not within the meeting itself, but may be listening. And if she's not listening, we'll certainly make sure that she gets a transcript of this and a reply from Jane Halpin, who's going to answer her question. Her question is, as a lifelong carer of my severely disabled son, I should like to ask what arrangements will be made and what priority will be given to ensure that adults with learning disabilities and their carers will receive appropriate priority and a thorough coverage for COVID-19 vaccinations. Jane, or Dr. Jane Halpin formally, would you be in a position to answer that question, please?
Certainly, very happy to. So thank you, Mrs. Barr, for your question. I'm going to answer it in somewhat technical terms, but if after the meeting anything is unclear, myself or others will be happy to explain. The government has asked the NHS to be ready to deliver a vaccination programme for England from December, so that those who need it most will be able to access vaccinations as soon as they're available. Nationally, the Joint Committee on Vaccination and Immunisation published updated advice this week on the priority groups to receive the COVID-19 vaccine. The Council, JCVI, has advised that the first priorities for the COVID vaccination programme should be the prevention of mortality or avoidable deaths and the maintenance of health and social care systems. As the risk of mortality from COVID-19 increases with age, the JVCI's prioritisation list is primarily based on age. The order of priority for each group in the population corresponds with data on the number of individuals who would need to be vaccinated to prevent one death, estimated from UK data obtained from March to June 2020. The priority list is as follows. Number 1, residents in a care home for older adults and their carers. 2, all those 80 years of age and over and frontline health and social care workers. 3, all those 75 years of age and over. 4, all those 70 years of age and over and clinically extremely vulnerable individuals. 5, all those 65 years of age and over. 6, and significantly in answering this question, all individuals aged 16 years to 64 years with underlying health conditions which put them at higher risk of serious disease and mortality. 7, all those aged 60 years of age and over. 8, all those 55 years of age and over. 9, all those 50 years of age and over. It's estimated that taken together, these groups represent around 99% of preventable mortality from COVID-19. I am pleased to note that this week, the risk groups of individuals with underlying health conditions referred to at point 6 in the priority list have been updated to include those with severe and profound learning disability and those with Down syndrome. NHS members of this board had made representations previously to NHS England and NHS Improvement, who were leading the programme of vaccination planning, to ask that people with a learning disability are considered as a priority group for vaccination. The JCVI advises that the absolute increased risk of COVID-19 to those with underlying health conditions is considered generally to be lower than the increased risk in persons over the age of 65 years, with the exception of the clinically extremely vulnerable, which explains the placing of this group in the priority list. JCVI has also advised this week that the implementation of the vaccine programme should include flexibility in vaccine deployment at a local level, with due attention to mitigating health inequalities such as might occur in relation to access to healthcare or ethnicity. The Health and Wellbeing Board recognises the vital role of carers and the health inequalities faced by both adults with learning disabilities and those who care for them. The updated advice on flexibility in vaccine deployment is therefore welcomed, as it indicates that carers can be prioritised as the vaccination programme is rolled out across our area. Thank you, Councillor Roberts. That's the response to the question.
Thank you, Jane. There isn't. I don't think we are going to receive a supplementary. I do hope Mrs. Barr has heard that answer, which is both fulsome. It is technical, but it's fulsome and it's clear. I just wonder, Jane, whether you want to say anything, and don't feel you have to, because I realise there's a lot of sensitivity at the moment. There's almost I'm not sure if I get the metaphor right, but it's the slip between cup and lip, is it not? Which has been announced that the vaccine is available for distribution, but it hasn't been distributed yet, and we haven't started on that programme yet. And it is at that very sensitive juncture that we find this meeting today. But you did say that there is the potential for some flexibility at the local level, and you also said that there have been some serious consideration around where those with severe disability might sit in this list. Do you have any further comment on that, Jane?
Probably two or three things to just expand on there. Firstly, we know that the Pfizer vaccine has passed its MHRA clearance and is about to move into distribution. However, we also know that this is the vaccine that has particular storage requirements and can't be moved around very much. So there's an initial amount of it coming into the country, but there are logistical challenges in delivering it that as you referred to earlier, teams are working on very much at the moment. So we are also hoping that other vaccines, notably the Oxford AstraZeneca vaccine, which does not have as stringent requirements around its storage and movement, will hopefully also be cleared soon, and it is likely to be available in larger amounts, which will mean we can move to those lower down priority groups and move through much more quickly. But that's probably going to be after Christmas. I think is our best estimate.
Yes, that's really helpful. The vaccination programme is a marathon, not a sprint, as somebody said to me this week. Thank you, Jane. That's really helpful. Tom, you wanted to come in.
Thank you. Can I just an additional message for Mrs. Barr and Jane? I think picked it up. I'm the chief executive of Hertfordshire Partnership Trust, who is a major provider alongside the County Council for services for people with a learning disability. And we just want to say that we are lobbying very hard, both locally and nationally, to make sure that people with learning disability are on the early lists. Jane is absolutely right describing the process. We will continue to lobby. We are talking to senior people within the NHS, trying to make sure, and there is a national drive to make sure that people with their learning disability are recognised, their risks are recognised. And I know that colleagues here in Hertfordshire fully recognise that and will support that lobbying.
Tom, I might just stay on screen a minute, Tom. Tom, I'm minded that the Health and Wellbeing Board, through you and others, but through you formally, might wish you to continue that so that we seek to almost include those with the learning disability, and therefore there is some assumption around health inequalities there as well that tend to arise, that we would seek that the lobbying to accelerate up the list might be there, and if we could do that through you, that would be extremely helpful.
Thank you.
I don't think we formally need. Does anybody? I'm going to turn this around. Does anybody think that is not a good idea? Please put so in chat. That's lovely. Teresa, if you'd like to come in and speak, thank you.
Thank you. It's more of a question, really, but I think that any public listening might be interested. I don't know whether anybody can answer this, so I don't expect an answer. Do we have any idea how many people in Hertfordshire fall in between the categories 1, I think it's to 9? It's just because it's very difficult, isn't it, to actually understand the impact for our county and then those numbers involved.
The short answer, Chair, is yes. We've got age profiles of everybody, and I'm sure Jane would say that the use of primary care registers will be a key step in getting all those people called and recalled to vaccination.
Yeah, but I just was looking for a quantification. Sorry, I don't know if that's possible at this stage.
Off the top of my head, I don't have it, but it is being done.
Yes, if I may, we probably don't need it here at the Health and Wellbeing Board, but it may well be that it's something that, as part of a broader understanding of the vaccination programme, it will go to potentially through to Tim Hutchins' panel in public health at the County Council. I think, would that be an appropriate mechanism, do you think, Jim?
Yes, I mean, I think that it's probably important to say that the work on vaccination is requiring everybody's effort. So I don't want to steal Jane's thunder, but there's a huge piece of work being done by the NHS. There's a huge logistics exercise which Scott Crudgington at the County Council is working on with others, and I think it probably requires all of us to oversee this, and Tim's panel will be definitely one place for reports. I suspect this forum as well, but obviously Jane will need to take reports through various ICS and CCG boards. Thank
you, Jim. That's really helpful. The significance of what is probably one of the biggest national endeavours over a short period of time cannot be underestimated, and the amount of work that all of you in this meeting are either in charge of or is significantly influencing, again, cannot be underestimated. I'm very grateful to you all, and good luck with that as we approach the Christmas period as well, where the expectation around both testing and the vaccination programme has increased exponentially this week. I will just say, Mrs. Barr, thank you for your question. we have your interests at heart. We have those with learning disabilities, both and physical disabilities, at heart. And through Tom, we will continue the lobbying process on behalf of the Health and Wellbeing Board. And I hope that helps to reassure you that we will speedily get to you and your son as soon as we can in terms of vaccination. Thank you. Jim, I think that takes us nicely to you in terms of a COVID update, and I'm grateful to you. Thank you.
Okay, thank you, Chair. I will attempt to share my screen. It wasn't liking it earlier on this morning when I tried, and I'm just wondering, can you all see that?
That's good, Jim.
Wonderful, great. So there's a lot going on, which is probably a bit of an understatement, and I will try and whiz through it very quickly. We have emerged from national restrictions into Tier 2, which is the high level, and I think broadly, I think that is about right for the county because of our numbers. If you look at the indicators that government are using, we are very much in Tier 2. I think that gives us a sign that while our numbers have been declining, they are still high, and the virus could spread easily and take off again if we're not careful. So we do need to be keeping going with the measures to suppress the virus so that we can emerge into a lower tier when we're ready to do that. And the emphasis is on making sure that we do as much as we can as a county safely. So our emphasis is on trying to help people do work, education, retail and leisure safely, and I'll come on to that in a second. There's a series of actions we're taking that I'll outline very briefly. Lateral flow testing is being rolled out. We're not using the phrase mass testing here. We're using the phrase targeted testing at scale because lateral flow testing is best suited to asymptomatic populations and is best used in a number of places. So we will be taking it very carefully. We have started to use it with university students to enable them to go home. We've started to use it in a variety of other settings with most vulnerable children and transfers of care. And we are beginning a very careful rollout in line with the national programme in care homes. Not every care home has it yet, but because that's a national programme that we are working very closely with to support, and Chris may want to add to that later. And we will make sure that we take a precautionary approach to doing as much as we can to enable visiting in line with the new guidance, but to do it safely. And then there's vaccination. And the key point about vaccination, of course, is that vaccination is not a silver bullet. Even though vaccination will roll out shortly, it will go, as Jane says, to people who are most vulnerable. The government's decision is about stopping and preventing mortality, about preventing death from vaccination. So it will take us, even as we roll out the vaccine, several months before we see a massive impact on the circulation of the virus and population immunity. That means until Easter, we have to keep on going on with the measures that we're taking. Vaccination is not going to suddenly make us able to open everything up by Christmas. And we have to be absolutely realistic about the expectations of that with our population and with ourselves. So if we want the vaccine to do its job, we need to keep on with all the suppression measures. In terms of a situation report, this easy, simple, user-friendly little diagram here shows you, if you look at the extreme right-hand column in a fairly livid shade of green, that our numbers are coming down. Our rate of decrease. So we are seeing 15.5% overall decrease between the 2 weeks ago and today, essentially. Now, we're not out of the woods yet. We can't just open up, because if you look at it, you can see some numbers are very high. Broxbourne is still at 185.8 cases per 100,000. Hertsmere 140. So we still are quite high, but we are coming down. So we need to keep on keeping on. And if you look at this graph will show you the case rate by age group. And the top line at purple is 18 to 22. We've seen a significant reduction in that age group, which is great, because that age group were clearly one of the drivers of infection. The 0 to 17 age group, which is the bright blue line, is still going up a little bit. But one of the good things is that having started to rise, and it's still higher than we would want, it's still around the 100 cases per 100,000 mark, the cases in the over 60 group are beginning to decline as well. Now that's good news, because they are a group that are much greater risk of going into hospital, and indeed Jane would probably tell you hospitals have been extremely busy with COVID, extremely busy with COVID. People may not be seeing it in the media, but to say this virus hasn't had, this second peak hasn't had an impact would be wholly untrue. So we have some choices. We are not going to lock down until a vaccine. We have to let some things work safely. Equally, we are not going to let it run uncontrolled, because that will, as we know, turn into deaths and turn into overwhelming NHS and care services. But equally, what we also want to avoid is we exit lockdown, people don't self-isolate well, people let the brakes off a wee bit too much, the numbers rise and we end up in another lockdown, which is what happened between summer and the measures we've just exited. So our preferred option is to sustainably keep suppressing this virus until we exit it, and until the vaccine has done its job and the virus has more or less had enough. The things that will get us out of this, we know, are the combination prevention measures that we take, you know, the Swiss cheese diagram that I've spoken about, ensuring we have test, trace and isolate working optimally, but also a kind of sense that we are in this together. We're doing this for each other. So over the last 4 or 5 weeks of the measures, we have been working to ramp up a journey to exit, which is, we call it 4 weeks to win 6 months, and creating a whole new pile of programs. The essential messages of that are, let's look to do what we can do safely. So let's help people shop safely, let's help people go to work safely, let's help people go to school safely, and tackle the key sources of infection. I would say that we do, I think, need seriously to address the fears people have because of misinformation about vaccination. I will be in the queue for vaccination as soon as I'm allowed to join it. But, you know, we recognise there are many people who've got concerns and fears, and we have to take those honestly if we are to get the vaccine to do its job. We need everybody who's eligible to take it up. So we are going to have to work together as part of our journey to exit on the vaccine hesitancy. Members will know that we've had 11 core work streams from the Health Protection Board on controlling COVID. I won't go through all of them, but, you know, care homes, schools, university and colleges, a range of different things, contact tracing, enforcement and compliance. And we reviewed every single one of these and added additional actions during the lockdown period. But we've also added 9 additional work streams. Further work on contact tracing, so we've invested a further £1 million in contact tracing. We've had further funding from the government, so we're very grateful for that. A new support service to help people self-isolate has launched, which you know, the majority of people in Hertfordshire will self-isolate if they have the things they need. So we've created a new service to support them do that. Again, this is district councils and county council working together. We're very, very grateful. More work on enforcement by the police, and a new force of COVID marshals will be hitting the streets in the next week to help people be safe around being out and about in public. We are doing further work on ensuring retailers as safe as possible. So we've produced retail guides. We're working with retailers jointly with our district councils. We are stepping up compliance support. We've launched a new toolkit for retail to keep retail safe. because we want our county to be safe and we want people to feel that they can shop safely. We also want to protect our retail staff, who are frontline key workers and not always well paid. So it's crucial that we do that. A kite mark scheme is being developed so that people can have confidence that hospitality and retail is absolutely COVID safe in Hertfordshire. We're rolling out further work on taxis and hire cars so that we will make sure that we have COVID care kits in hire cars for transporting children to education, but also transporting adults, and to protect the drivers, many of whom in Hertfordshire are BAME. I invite public transport operators to come and talk to me if you think there's more I can do for them. We continue the mental health work that we're doing, and a further tranche of mental health training for people working in care homes has been commissioned, and I'll come on to the business stuff. And those group into 4 key priorities. Roll out lateral flow testing appropriately and prepare for vaccination. Ramp up contact tracing and self-isolation and improve our data. Build that end-to-end self-isolation pathway and tackle those key sources of transmission during lockdown. We know that we have an ambition to make Hertfordshire the place where we do some of these and model some of these. So you'll be aware that over the autumn we developed a plan that we were proposing to demonstrate some things, be the first to pilot a number of things. Well, you know, we are the first to pilot a roaming model of lateral flow testing. We are the first to kind of launch this wraparound self-isolation service and a number of other things. So we do want to do more, particularly with our BAME communities. I'll skip the combination prevention slides and just finish on this one. So this week we launched with the Hertfordshire Growth Hub a wellbeing programme for employers and businesses. And that wellbeing programme includes a fully funded psychosocial advisor for businesses and who will do training, a series of webinars, a resource pack, and you can see the front cover of one of those resource pack documents there, which is a how-to guide for business, as well as a range of psychosocial skills advisors for business. The reason we've done that is because we reckon 2 things. One is we don't want the demand for mental health services to grow, because Tom will tell you he's got growing demand every day as it is. And the second is we want our businesses to be successful. And the third is we know that mental health is a huge issue during these times. So there's a lot going on. I have barely skimmed the surface of some of it, but I'll stop there, Chair, if I may, and happy to answer any questions anyone has.
Jim, that's really helpful. Thank you. If there's a feedback, if we could just mute out, guys, that would be really helpful. That's it. Tim, you wanted to come in.
Yeah, thank you, Richard. I'll be brief because I think Jim has been pretty comprehensive. But I did want to reinforce some of his messages. This is not over yet. A lot of news obviously around vaccines at the moment, but I do want to emphasise it's not over. It won't be over for probably several months yet. And given our numbers, yes, there is some decrease, but it's not so rapid that we need to start celebrating yet. They're much higher than I would like to see, and I'm sure colleagues around the table, the virtual table, would like to see as well.
We understand.
And on that basis, I'd like to say there's a colossal amount of work going on in Hertfordshire at the moment through local authorities, through the health service, through all sorts of agencies and stakeholders. And I think we should be extremely grateful for that work that everybody's doing. I think it's really significant. And of course, repeating what we've said in the past about the public in Hertfordshire, you know, this only works if the public are vigilant. So we need to thank, I think, the vast majority of our residents who are vigilant, and to remind those that aren't that they too have a responsibility to make sure that they cover their face where appropriate, that they keep their space, that they maintain their hygiene levels. and particularly at this time of year, we don't want them taking anything home to their aged relatives that they'd rather not.
Tim, that's really very thoughtful and appreciated. Thank you. I've just seen in the chat, Nicholas, you've put something up there. Could I just invite you to say your words so that those who are watching can appreciate your sentiment?
Yeah, I thank you, Chair. I think that we just need to give a really important thank you to Jim and the public health team who have worked tirelessly behind the scenes, putting in hours beyond comprehension in order to maintain the health and well-being of our community in Hertfordshire. I think there are so many aspects of what's going on that people wouldn't necessarily directly connect with public health. And I think if ever there was a need for the demonstration of an investment in public health and the connection with population health, this has been it.
Thank you, Nicholas. Endorse that. There is a huge amount of effort going on, and it's going to continue for months. Jim is only 27, and you can see some of the toll that has been taken on him personally. Steve, you'd like to come in?
Yes, thank you, Chair. Firstly, just endorse what Nicholas has just said. I think the effort has been extraordinary. And in particular, I'd like to, on the last bit that Jim was mentioning, which was about work on mental health, which is some of the work we've been doing, really emphasises that this is something that isn't going to go away in 6 months. However successful the vaccine is, it's a long-term issue. So I really thank Jim for the work on that. I've got a specific question about the vaccine, which, given that the highest priority is care homes, and that the current vaccine we got, the Pfizer one, requires all this long-term storage. I think it comes in batches of over 900. It has to be frozen at 70 degrees. The logistics of actually getting it out to the care homes seems to me to be very difficult. Is that something? I mean, clearly it's something I know people are considering. Where are we on that?
Thank you, Steve. I'm going to let Jane. Looks like she'd like to come in. Thank you.
Yeah, I'm happy to firstly sort of in part respond to Steve, and then I had a second point I was going to make. You're right to flag the extreme tension basically between the desire to prioritise care home staff and the reality of the requirements of this particular vaccine. There have been a number of conversations, certainly one I was party to yesterday, and I think there were further conversations going on to try and work that through. There is a very real balance to be struck between vaccination as a protective measure and not actually inadvertently exposing care home residents to more risk in accessing that vaccine than it is going to be faced otherwise. It may well be, therefore, that it is not possible to vaccinate all of the care home residents with this vaccine at this point in time, but I just put that as a possibility because of the extreme challenge of the transportation and storage of this particular vaccine. But I would sort of reflect back to my earlier comments about other vaccines coming hopefully hot on the heels, which are much easier to transport and likely to be manoeuvrable in smaller quantities. So what we will do in the planning for vaccination is ensure that we hit as optimal a balance as possible between starting with that highest priority group, but also not wasting a very small amount of a precious vaccine. And there will have to be some trade-offs, Steve, I think is the honest answer. We just don't know quite what they are at the moment.
Jane, that's really quite candid. It's really helpful. And it speaks of some of the flexibility that we will need in the system to cope with the different formulas and storage and transport and refrigeration, all the rest of it, and that's helpful. A couple of comments that have just come in here. It's probably best if you speak them, but I'll just read them out. This is from Paul Bairstow. Very pleased to hear Jim speak about the psychosocial impact and the work being done on this. The ICS Partnership Board will also be discussing the mental health impacts and demand pressures that will arise and how best to meet them. So thanks very much for that, Paul. I know you'll be leaving shortly, so your comments appreciated. And Teresa, let's remember that our children have been faced with immense mental health issues, which may take several years to work through, thanks to our education settings. Of course, teachers are on the front line there and have probably been quite stressed by whether they are likely to get the virus or not. And Prague completely endorsed what Nicholas said. Thanks, Jim. That's great. Okay, are there any others? Jane?
Richard, could I just, it was just a second point I wanted to contribute, and it's in part to reinforce what Tim has just said, but also in part to answer Terry's earlier question about scale. So just back of the envelope calculation around the likely numbers of people to be vaccinated in those priority groups within Hertfordshire would be of the order of 430,000 people. And each vaccine requires 2 doses to be delivered. Within that roughly 430,000, around about 200,000 would be in the 65 and older age group, so amongst the highest priority group. Now, with the best planning in the world and the smoothest delivery in the world, the size and scale of that vaccination undertaking is going to take time. And therefore, it was just to reinforce Tim and Jim's points about this is immensely hopeful and helpful, but there is quite a long time still to be worked through while this rolls out.
That is a message that is worth emphasising as we enter the Christmas, the festive period, if you like, that the vaccination programme will not have had an impact, and therefore please be careful and abide by rules that you understand that Jim and Tim and yourself, Jane, and all of us will be promoting through our organisations. But just be careful over this Christmas period because there is still a lot of virus about. And Jane, I think, spelling out that we will need to inject we'll have to inject 800,000 times just for the approximately half of our population puts into perspective what the challenge is ahead of us over the coming months. That's really helpful. Is there anybody else who wanted to come in commenting about, for example, either our infection rates, the impact of them, or even commenting on the vaccination programme? Christine, if you could come in, please.
Yeah, thank you, Richard. Just to pick up points that others have made around the impact on the NHS. So from an acute perspective, all 3 of the acute hospitals have seen significant numbers, as Jim alluded to. We do have patients in ITU. And at this point, the numbers are not declining. We all have, slightly different numbers. Watford is a hotspot again, as is Princess Alexandra in Harlow, and to some extent East and North Herts. But we are all seeing that input. So I think all the comments about vigilance are just so important because, we're at the end of the line really in terms of impact, and we're still seeing that.
Christine, do you want to tell us, Christine, sorry, you may have just done, I missed it, but do you want to tell us how many patients you've got with COVID in the hospital at the moment?
I can do. Obviously, I haven't got the up-to-date numbers for all of the trusts. I can only speak probably for mine at the moment. But as of yesterday, we had 80 COVID patients and an additional 4 in ITU.
Okay, thank you very much. That's really helpful. Thank you, Christine. Again, reinforcing that message that we do need to still be very careful, otherwise we will overwhelm the NHS, and all the support that goes around that as well, including, for example, the discharge teams and back out into care homes and back into individual homes. And if we're not careful, we don't make that any easier. So grateful for those comments. Is there anybody else that wanted to contribute just at the moment? No, that seems. Jim, can I just say thank you once again for the update? It's really helpful, and some of the messages that can go out, I think it's a helpful forum for those to come out from the Health and Wellbeing Board, where all of health and social care and the voluntary sector and police and local government in all its glorious shades is here. So thank you very much. That's super. We'll move on. One sort of small apology. I didn't introduce you, Jim. Jim McManus, as you all know, is our Director of Public Health here in Hertfordshire, based at the County Council. And I haven't introduced all of you in this meeting at the moment, just because we all know ourselves, and actually let's crack on. And in similar vein, I would like to introduce the Interim Director of Adult Social Care, Chris Badger, to introduce the adult social care side of the winter plan, in how we will get through this autumn, winter, and into spring, really, in terms of social care. And then after that, we'll have Tom Hennessy introducing it from a health perspective. Chris, are you with us?
Richard, do we need to vote on item 3?
No, we don't. No, that's fine.
Okay, thanks, Richard. Are you okay for me to crack on?
Yes, thanks, Chris.
Okay, thanks, Richard. So yeah, paper before you is the Adult Care Winter Plan. This was mandated by Department of Health and Social Care for submission by the 31st of October. Thought it's important to share. While it is a plan for adult care, I think you'll find it's absolutely in lockstep with other partners and part and parcel of the wider multi-agency response to COVID. I won't go through all of it. I'll just highlight a couple of issues. One is the important work that colleagues in social care, NHS, and crucially care providers have been doing around managing infection control within care settings. We know that was a particular area of outbreaks in the first wave, and sadly mortality. I think that the colleagues there will see we've laid out the multi-agency response to, for example, care home support infection prevention and control within care homes, whether that be around PPE, training and advice, but also discharge arrangements. Linked to that is the ongoing and I think particularly difficult issue around care home visiting. Jim alluded to lateral flow testing, which is being rolled out as we speak. New guidance on care home visiting will be released later today. A number of training sessions with care homes are taking place today and next week to support them in doing whatever they can to open up safely to visiting, because of the importance it has on the health and well-being of both residents, their carers, and indeed staff. I would like to commend the work that care home providers in particular have done, and their staff, in managing the COVID outbreak and the pressures they've been under. And actually that has borne fruit in terms of a much more limited impact on care homes, albeit still with tragic elements, but a much more limited impact on care homes in the second wave. The other thing I'd point out, and these are all laid out in 2.1, is the work around supporting individuals leave hospital safely, work with integrated discharge teams, working very closely with acute colleagues, striking that balance between supporting acute settings with discharges and also protecting care settings from COVID. We're glad that we continued the designated settings that we'd set up to support COVID positive discharges on both sides of the county, with units that were demothballed in the first wave. But to echo Christine's point earlier, the pressures in acute settings and in discharge remain extraordinarily high on a daily basis, and the teams are working really well together. And I think actually there's some learning around how those teams and we work with acute colleagues that which will actually serve us well in the future, and that's to be commended. 2 more points just as summary. One is the importance of informal and unpaid carers. That was alluded to with the question, and I think it's important that we do consider how we support carers in the vaccine programme, but also more widely in the second lockdown, the County Council and the Commission providers did everything we could do to keep more services open than we did in the first wave, including a comprehensive offer around day services for individuals with a learning disability or physical disability. I don't think it can be overestimated the impact COVID has had on those people caring for loved ones in an informal, unpaid manner. Particularly, a good example of this would be those caring for people with dementia, and we've recently agreed an interim dementia strategy across partners, and had an update on that yesterday about the work we're trying to do to support carers have a break, support those services that support individuals in the daytime, but also proactive work ringing around carers and finding out what issues they've got and what support we can give them. Finally, just to say, we've invested a lot of money through government funding in providing financial sustainability to the care market. And to date, we've not had any providers fail as a result of financial difficulties. Included in that's been a significant support around PPE and staffing costs. That equates to about £23 million of support to the wider care sector in Hertfordshire. And that funding and support has been guaranteed until the end of March by the County Council to ensure that care providers are going into the winter with confidence around their cash flow and financial position, so they can focus on infection control, supporting acute colleagues, and essentially delivering the best possible care to people who need it in Hertfordshire. So they're the main elements of the plan to just highlight. I won't go into any more detail than that, but happy to take any questions. Oh, Richard, you're on mute.
There we are. Yes, that's good. Thank you, Chris. Jim wanted to come in.
Yeah, thank you, Chair. I just wanted to reinforce a bit of what Chris was saying. Firstly, we have benefited in Hertfordshire from a care home sale, which has been made up of NHS, social care providers, public health, and others, that without which I think we would have really struggled. And that sale has done huge work, and Tom, who you all know, and Anna have led that. And I know that others have replicated that model elsewhere. And the work of Herts Care Providers Association has been stunning. I mean, just stunning in this. One of the things I think that's helped us has been that we've developed specific cells and teams. So there is a schools team that includes a bunch of infection control nurses. And Tim Hutchins will know that in the last 3 months, I've recruited 16 health protection nurses just to work on schools and care homes and other work. And also Chris has done other stuff. So I think that stood us in good stead. We've had the learning from the first wave to take us through winter. But I think it reinforces the fact that nobody should think that COVID is gone, because as Christine said eloquently, it definitely hasn't.
There we are. Thank you. Once again, reinforcing that message. Thank you, Jim. Colleagues, do we have any further comment on what is now absolutely active practice as opposed to a report coming to you? How we support carers during this winter period is going to be as important as anything that we do in terms of making sure that those that they look after don't are. Sorry, my screen just went nuts. Apologies. To ensure that all of our agents are able to cope this winter. Chris, thank you so much for presenting that. And if I've got no further comment, I think what I will do is take, in terms of noting and voting, I'll take 4 and 5 together. I don't see that being a problem unless I receive some grief from chat. So I'm now going to introduce or ask Tom Hennessy, who is Integrated Health and Social Care Lead for East and North, to introduce the NHS Winter Care Plan.
Thanks, Richard, and sorry for just joining late for this meeting. Yeah, I'm Tom Hennessy. I'm the Assistant Director for Health Integration, and I'd just like to give you a quick run through the winter plans produced by the 2 CCGs as part of their winter preparedness. So I'm sure people have seen the report, and you may even have had a chance to go through the individual winter plans for both Herts Valleys and East and North Herts ICPs. Each year, the clinical commission groups have to provide assurance of their resilience and preparedness for winter through developing a multi-agency plan and how they intend to work in partnership to respond to the challenges that will be brought about by winter and seasonal flu. Obviously, this year, it's rather unique set of circumstances because we've got the additional pressures of the health and care's response to COVID-19. And also just like to mention that this year, for the first time, adult social care have also had to produce a winter plan, which has been received very well by the Department of Health and Social Care. So you will have received the report, which outlines the approach that the ICPs have taken to work in partnership, and also including the important contribution of the voluntary, community and social enterprise sector. I think that's really important to state there. They have a huge role to play in our population's health and well-being, and their ability to get through winter. Both plans set out the contingencies that we've got in place, such as surge and escalation plans, for when any part of the system signals a significant issue or pressure that we then all can support each other to respond to. These pressures can come from surge in admissions in ED, delays in hospital flow, low staff levels, or capacity in home care. It could be a whole variety of reasons why it would put the system under pressure. And these plans are important so that we can see them coming and make sure that we respond accordingly. Section 4 in the report, I appreciate there were two section 4s, but the first section 4 outlines a whole raft of key priorities that are linked into both sets of plans. I'd like to particularly draw your attention to the NHS Think 111 First helpline. That's part of a national rollout. You may well have seen some adverts this week, and that'll be continuing, just trying to help manage that flow so that people don't, as their first response, rock up at ED, the acutes. There's also the hospital discharge policy requirements. This is how we're going to work much more efficiently and collectively in supporting the outward flow of patients from a period of time in an acute hospital into the community, and that is working really well so far. We've got same-day emergency care standards that have been developed, and we're working towards those. There's acute frailty pathways, obviously flu vaccination. The target is 100% of health and social care staff receiving the flu vaccination. We're working really hard together to ensure that we keep our staff as well as possible so they can continue to provide the services. There's an awful lot of work that's gone on over a number of years, but a real focus on supporting care homes to make them more resilient, and that's through training and support. And that's never been more important, in my view, than what we've seen over the last 8 or 9 months, with how health and care partners have really rallied round, particularly GPs as well, have really rallied round supporting care homes. And obviously, I did mention the voluntary sector. They have a huge role to play in this. Naturally, there's a great deal of focus at the moment, and rightly so, on the rollout of the COVID-19 mass vaccination. There's a call for all health partners to release a proportion of their staff to support that rollout. Local authorities are heavily involved, both county and districts, in making that happen. That may well have an impact on our ability to deliver against some of those priorities, but largely the expectation is all those priorities will be met and worked towards. So that's a real canter through. I'm happy to take any questions, but I'm hoping that the board will note the recommendations. Sorry, Richard, I can't hear you.
My apologies. Thank you, Tom. Board, are there any further contributions, particularly from health, in terms of reinforcing those messages? Tim?
Yeah, I think it is. I thought Tom's report was really helpful. And again, going back to the pressures on the NHS, I think it's really helpful and important to emphasise, this time, COVID or not, this time of year, the pressures on the NHS are really significant. And, COVID is just an added pressure, if you like. So again, it's another reason why we need to be more vigilant. And of course, if you look at the vaccination programme, the more people we can get out doing the vaccinations, the better. So the fewer that are required to be working in other scenarios is a good thing as well. So it's just the same old story, but again, I think it's worth repeating.
There we go. Thank you, Tim. And I'm more than aware that not only have we got perhaps 80 odd COVID patients in Watford Hospital, for example, slightly fewer in the Lister, but I think we've probably got more than 200 staff off in isolation or with COVID as well, and that puts stresses and strains on the system. Some of those coming into the hospitals are perhaps more poorly than they might have been. And again, that requires more nursing when they arrive. And of course, we need the beds and the capacity within the community when they leave hospital. And of course, the more patients through flow, the more pressure that brings to the system. So we've got flu, we've got normal winter pressures, and we've got COVID. So I think it's reinforcing what Jim said as well, that how we respond to these plans and make sure that we all work as proactively and preventatively, i.e. using 111, for example, as possible, then that absolutely makes sense. Thank you. I see, Steve, you wanted to come in. That's great. Thank you.
Yeah, thank you. Just a quick question. Under the first lockdown, one of the things that's happened was excuse me, there's quite a large reduction in the number of people coming into A&E. That doesn't seem to be the case any longer. Is that right? Under the second lockdown, numbers are as normal or higher? Christine.
Yeah, thanks, Steve. I'll pick that one up. Certainly from the experience of West Herts, at the beginning of the second lockdown, we saw slightly less patients in ED for probably 2 or 3 days. That was all. The numbers are now absolutely back up where you would expect them for this time of year. And I suspect the other acutes are exactly the same.
Yeah, thanks, Christine. And I think it's fair to say, and you all know this, but the south and west of the county has had a bigger impact in terms of numbers of COVID, and we've got a density of population where infection spreads as well, and we see some of that in the demand both at Watford, but obviously for GP services, and then of course into social care. It really is a joined up system if we want to make it work as well as we can for our residents. Thank you for that. I don't think I have any more speakers, so if I could ask you to note both the report under 5 as presented by Chris and under 4 presented by Chris, and 5 the winter care plan across health and social care, I'd be grateful. Thank you. There are colleagues. Thank you. That's super. That's noted. Appreciated. So now, as I said, if we have covered an awful lot of ground already this morning, just picking up. Sorry, we've got a few more coming through. Apologies. Let's just get rid of those. That's great. Colleagues, we're now on to agenda item 6, which is an update. And we've covered some significant amount of ground, both on vaccinations and on infection. We've covered testing. So I think I would invite those who haven't spoken or wish to say something that hasn't already been said to offer up. And I've got Tony first, and Tony Kingsbury, and then Tom, and then Elliot.
Thank you, Richard. Tony Kingsbury, leader of Welling Hatfield Borough Council. We were asked to do some reflections on what happened over COVID. So I think a key thing is, it's massive changes to us and probably to all organisations. But I think what's been really key is partnership working, which has worked really, really well. Both on partnerships we had before, really, and in terms of making new ones and making those work. In terms of our members, I mean, as leader, there's been an awful lot of meetings between leaders, and perhaps the other leaders would agree with that as well, which has been really, really good. Perhaps some of the other members in terms of health portfolios haven't been so involved because it's gone up a level, which it probably needed to do, to be honest. I think the setting up of certain cells under the LRF in terms of dealing with certain issues has worked really well. And specific to Welling Hatfield, we've been leading the university cell because obviously we've got the University of Hertfordshire and the Royal Veterinary College there. And internally as a council, and probably true of other areas, we've had to work in very different ways and use different technologies, much like we're doing at the moment. And I think that's a positive because we can use that and work with that going forward. And I'd like to thank the County Council as well and Jim for support and funding opportunities we've had for the borough and district councils, and also support from things like project managers to helping out with certain projects that we've needed to do that have been COVID related. So that was really just an update, and that's all I want to say. Thank you.
Thank you, Tony. That's appreciated. Can I invite Tom come in next, please, and then Martin.
So yes, Richard. In the same vein, just a bit of an update from Mental Health and Learning Disability and the Trust, and we're very conscious that the acutes have really had a tough time during both outbreaks, and particularly A&E and particularly coronary ITU. Overall, for the Trust, we've had 104 deaths during the period, and smaller numbers than national, but huge for us. And we know about 20% of those have been from people with learning disability. Not all reportable by us because they've died out in the community settings, but 20% being learning disability is important given the conversation we had earlier. I think there was a lot of trying to manage the uncertainty and finding our rhythm were some of the biggest points. None of our services closed. What we did see was a drop-off on IAPT in the first phase, referrals, but not in the second phase. We're full tilt in terms of IAPT, and IAPT being really the primary care element of it. Also in memory clinic, we weren't able to do some of the diagnostics, so we've now caught up with all of that. Big issue for us was risk assessment and how do we keep an eye on our clients in the community. So we had 4,000 overall that we needed to keep an eye on, but 1,000 of those were deemed to be the highest risk. So either face-to-face, risk of physical well-being or mental health well-being are combined. So we had to put approaches in to make sure that we maintained contact, and that was mostly face-to-face, although quite a lot virtually we managed to keep in contact. We still don't know yet how effective that was. We're not seeing an increase in suicides, but we're definitely seeing an increase in incidents. What it really is, what we're left with, there's two things, and I think one is common across the board is workforce, and workforce are tired. And I know that I speak for a lot of my colleagues, both in health and social care. And we need to recognise that as a health and wellbeing board. People are absolutely tired. This is not a resilience issue. They have gone up and beyond. They have gone through all the resilience barriers, but they are just tired. And whilst we encourage them to have leave, we all know that leave in this current climate is not quite as meaningful as leave in historically what we used to. And then the final issue for us is what we're really seeing is demand and acuity. The numbers, we think about 10% up across the board, but we're seeing acuity. And we start with children. We're really seeing young people struggling all the way in primary care, schools, all the way up to secondary care, and particularly people with kids with eating disorders and looking for specialist needs. We have got about let's say 25% more out than in beds out than we would have normally expected at this time. We know our tier 3 are back up and seeing people within the timely fashion. We're absolutely full. We know that primary care is seeing a lot more youngsters. Similarly for adults, we're seeing a lot of new faces, first time referrals, but also an intensity of those people that we hadn't quite seen before, and older people very similar. So I think across the board, and I think Jim referred to it earlier, there's really got to be a system-wide response to dealing with the emerging mental health surges coming in. And it's not traditionally as we know it, it's employment. And we haven't quite hit the economic downturn that we all know that's coming. And we know that death and suicide are really a high combination. So generally from us as an organization, I think we've found rhythm now. We think we know how to do. We know all about the PPE, and I know many of our other trusts will found that. But actually, it is just a challenging environment, and my biggest fear is for workforce.
Tom, thank you for that. I'm just picking up that point which we've we elsewhere that it is a system approach, and if we don't have the support within the community for those that are falling out of employment, that are falling on hard times, that can't meet their bills, maybe they've got a lower paid job to fill in whilst waiting for further, there's I fully appreciate that is a challenge now and for several months to come, possibly all the way through this coming year. I think we should stay in close contact with you in terms of how we plan for that mental health surge, as you put it, and that's a helpful update and a warning that your system and your part of the system is under strain as well. Thank you, Tom, for highlighting that. I've got a number of speakers now. Martin Stiers-Hanscom.
Yeah, so I'm leader of North Heights District Council, and I think we've got a number of common themes coming out today. Certainly echo what Tony Kingsbury said about the way that the districts and boroughs working with the County Council and working with Jim, and again, huge thanks to Jim and his staff for the massive things they've done in leading us on this. In terms of the way it's affected our council, of course, what I have to say is I'm absolutely proud of our staff for the way they've stepped up. It's been a massive effort, and having to very quickly work from home and the different ways that they've had to work, ensuring our services continue, but at the same time being flexible and stepping up to doing different jobs if that's what's needed and what's possible, maintaining services and so on, and getting involved in the shielding, in the track and trace, and all the other things that we've been doing together. As has already been said, there's been a huge effect on local businesses. We've been supporting our local businesses, working with our local business improvement districts and supporting individuals as well. And looking forward as well, as we've had the second lockdown, of course, moving back into the response phase, but also looking to recovery, building a recovery plan and trying to build back better. There's so many common themes. And I think the thing in terms of this board that's coming through as a common theme is the effect on mental health. And I think there's both a short-term aspect of that, where largely, and I agree with the point about tiredness and exhaustion, we've got some very resilient staff. They've worked extremely hard, but they've really worked beyond what's expected of them. They've not been able to take breaks as they would have done. We've tried to encourage that, as Thomas said, but of course, people know that there's work to be done and they've stepped up to do the work. And there's a massive amount, and working with voluntary sector, the effect it's had on charities and so on, we're very aware of as well. But I think also there's a long-term effect on mental health. I think as people have been working on this project that we're all working together on, there's been a sense in which that the adrenaline has kept us going. But I think long term, we don't know yet what the effect long term will be on the resilience and mental health of our staff in many ways. And I think that's something that as we look at the sort of interventions on mental health, we need to take account of that as well. But just to echo the massive we've worked, I think, more closely with our colleagues right across the sector in ways. I think we did that in some ways in different settings, but I think that the working together has been really massive, and there's a huge thank goes to everyone, as we said, led by Jim. So thank you.
Thank you, Martin. That's brilliant. That has come through over the last 6 months. The step up in partnership working, systems working more closely, sharing data, and just doing it more effectively. We can't go back to where we were before. So we have taken a big step forward, in a sense, in how we all work together. We collectively should acknowledge that. And thank you for the acknowledgement of your workforce. That's great. So coming through, Elliot wanted to come next. Then I've got Jenny and then Sarah.
Yes, thank you, and thank you for. Sorry, I was joining late, but thank you for having me on the group. I'm Elliot Howard-Jones, for those that don't know me, the new Chief Exec at Hearts Community from the 1st of November. Always dangerous to try and give an update, but not repeat stuff that's already been talked about when I haven't been part of the meeting. But I think a few things just to pick up on. No doubt you've had an update about mass vaccination and talk through that, but I just want to talk through the slightly longer term into the beginning of next year in terms of what's happening on this, because we've got some difficulties and some challenges that we're working through in terms of the initial delivery of the vaccine, and we're working with East and North Herts Trust to make sure that we align what we do. But we've redeployed our specialist school-aged immunisations team into the COVID vaccination service and backfilled them with staff from elsewhere to use their expertise. We're recruiting additional staff through NHS professionals, volunteers, council, other routes at around 30 a day in order to be prepared for large-scale mass vaccination in January and beyond. And I've had a number of conversations with big employers in Hertfordshire, so the pharmaceutical companies and with some of the airlines just out on the border of Hertfordshire, around using some of their staff and using some of their staff who are furloughed and or have been made redundant recently in order to use their skills as part of this as well. And I'm also speaking to the Chamber of Commerce, Herts Chamber, about that as well. So I think we're getting on well with terms of the recruitment, regardless of the slight back and forth in terms of the initial start of this. We know that in January, February, March and beyond, we'll be into significant numbers, and we're planning for those services and centres to open, and particularly echoing the workforce issue about the amount of workforce that we need in those. At the same time, we've been keeping our current services going. Echo the point about the reduction in referrals. We've been able, because of the reduced numbers of referrals coming through during COVID initial phase, phase one, if you like, to be able to catch up on those that were on our waiting lists. But that is, to be clear, that is only because we had a reduced level of referrals earlier on in the year. If we'd had the same level of referrals all the way through, we wouldn't have been able to catch up. And I think there's a key question for this that would be a really helpful debate in this group at some point, to say, how do we find where those referrals didn't come from, if that makes sense, and what was the effect of those referrals not coming into the system? Because if we knew that they came through and there was a need waiting there, it'd be easier to triage what was going on. But actually, because they never made it into the system, what's the effect of that? The last bit I would, but we are being able to recover services as a result of that reduced level of referral. The last bit I'd say about is in terms of winter and COVID support. So we've stepped up a number of prevention of admissions and discharge home to assess that will be running in an expanded way over the winter. We're also picking up, to echo Tom's points around children's issues through our children's services. We're picking up increased anxiety and issues around children's through those services as well. And we're talking to Tom's team about how we make sure that we coordinate a response back to those. Lastly, I'd just say again about the staffing tribute. We've had and still got staff in and out of people's homes. That's anxiety inducing both for the staff and for the people in their homes, but it's the right thing to do. And we're running more clear and more assiduous triaging in order that we can spend more time with the right families and with the right people to do that, and going through that in order that we make sure that we focus our time correctly. So a brief update, but hopefully helpful, Richard.
That's really good. Thank you. Elia, thank you. And it's great to have you on board, and we'll catch up soon. It'll be good to come and meet you in person as soon as possible. And next, I'd like to invite Jenny Coles, Head of Children's Services at the County Council.
Hello, good morning, everyone. Yes, following on from what other people said, in terms of children's services, the return to school in September has been an absolute major priority. And we've paid lots of tributes, but paying tribute to schools who are at the heart of their community and so important to children's education and all-round development. And the joy of children returning to school has been, the young people I've spoken to, has been really, really heartwarming. And that partnership between, a whole range of health services, public health and services across the council, not just children's services, to enable that return to happen. And we're now 2.5 weeks, 3 weeks off the end of term. And I think for a whole range of people that couldn't come soon enough. But the amazing achievement of getting to Christmas, you can't underestimate it. In terms of broader children's services, social work teams, youth workers, and a whole range of services have been back to face-to-face visiting from the summer, and that hasn't stopped. With adequate PPE when that's necessary, and short break services, for example, for children with disabilities are continuing to be open, and that close working with parents of children with disabilities has happened throughout. Young people have reported to us around anxiety as being one of their top concerns. And, as Elliot and Tom know, the range of mental health and the importance of getting in there early. Certainly we've seen a big increase in referrals to our school counselling services as well. But really welcome children's community health services being fully back on the front line. They had to be diverted, understandably, to assist in the first wave, but it's so important that early help, particularly to new parents, and our maternity work stream under the ICS is really doing really, really good work around that, and I'm sure will stand us in good stead over the year. And I'd just like to say two things in terms of the impact on children, which we've said in the two previous reports, that we see this will gradually emerge and it's not going to go away, at least for probably up to the next 18 months or 2 years. And it's absolutely in the territory of the partnership of the Health and Wellbeing Board and indeed the Safeguarding Partnership, which we've got the annual report later.
Yeah.
And the challenges around families that are facing, many are facing new financial challenges, and the impact of of losing your job or going on furlough, or as we expect the economic pressures to come. And as you all will be aware, the government has announced 2 schemes. One, the Winter Grant Scheme, which is being coordinated by the local authority, and the first stage of that is food vouchers for children on free school meals, which will be distributed in the next couple of weeks via schools, and then broader support around utilities, support around paying utilities and bills, and that's going to be a partnership with our colleagues in district councils, Hearts Help and so forth. Following on from that, there's going to be an activities and food programme. We're in the early stages of planning for that, and that'll run in the Easter holidays, the summer holidays, and up until next Christmas. And out of all that, we're clear that this needs to be in a broader context. And so the council has and will be contacting a broad range of stakeholders to have a family poverty strategy for Hertfordshire because of the challenges that we know are ahead, and linking that to the skills agenda. And Chair, I'd very much like to recommend that strategy reports into the Health and Wellbeing Board. It clearly will have very close links with health inequalities as well. Thank you.
Jenny, thank you for that comprehensive update. I certainly think the winter support for families right across the school holidays through Easter and beyond, and then with the Sustain programme, which is financed, I think, something to the tune of about £3.5 million. Those are big programmes of work to support families right across the county. And as you have intimated, that working with both our district colleagues and across the whole sector is so important at the moment. And I look forward to seeing the new family poverty strategy. That will be really excellent to bring forward to through your own panels, but also through Teresa, but also here to the Health and Wellbeing Board. Thank you. I'd now like to ask Steve Palmer and then Prague and Nicholas.
Yes, thank you, Chair. I won't go into a big update because I think there's obviously time constraints, but I'd like to mention just a couple of things we've been doing. We did a survey on the impact that COVID's had on people and on mental health. One of the interesting statistics I found was that some 40% said it had a severe impact and 20% said it had some impact, but only 20% had actually sought any help on this. So there's clearly a gap between people suffering mental health and actually doing anything about it. And I think that's clearly something other people have picked up as well. Our survey also picked up on dentistry, which has become quite a very difficult issue. People are having a great deal of difficulty accessing dentistry at all. So I think that's an issue we need to keep on it and keep a look at. There's some things we haven't been able to do. Normally, as you know, we have program of looking at care homes and going into hospitals and doing work and seeing how the patients are actually involved. We've not been able to do any of that work for obvious reasons. You don't really want lots of people walking around hospitals and care homes who don't need to be there. So that's something that hasn't happened. We're in the middle of projects on dealing with the health problems that veterans are suffering, and also we're doing stuff on discharge from psychiatric hospitals. So there's a lot of stuff that's happening. I could go into a lot longer, but I'll just leave it there because I know that we are obviously pressed for time. Thank you, Chair.
Thank you, Steve. There's a couple of really good point there around dentistry. I remember seeing some figures. There are parts of the county where oral hygiene is not as good as it might be. It might be that Jim, when he finishes up after the other speakers, might want to just pick up on that as well. My apologies to Sarah. Can I bring in Sarah Wren, please, who'd also asked to speak?
Thank you very much. Yes, I lead one of the largest third sector organisations in Hertfordshire, but I'm here today speaking on behalf of the whole sector. And I think I'd just like to start by saying that actually is quite a challenge, because there are probably at least 5,000 charitable organisations in Hertfordshire, and then there are many others that work in the sort of third sector. So representing all the great diversity is quite challenging. I think what I'd say firstly about the response to the crisis is that there has been remarkable partnership work, and that is not just been within the sector, it's also been across sectors, and that has been an incredibly positive thing. But also, I think that the sort of common themes for our work in the sector have all been based on the fact that we are so close to the people who we serve. There is an excellent understanding of the real needs of our communities, of the health disparities, of the different needs that people are facing, and we've all been able to respond on that basis. Now, so saying, again, there's been a very different response. There have been small voluntary organisations who have entirely stopped operating during this period. And I think that's something, again, we have to keep a very close eye on, because none of us yet know whether they will be able to start again, and the gaps that may be left if they can't start operating. The majority of third sector organisations have learnt and adapted to virtual new mechanisms of supporting people. And of course, there are others like Hills, the organisation that I work for, that have carried on with face-to-face contact with people throughout the entire crisis. I would like to make a mention of the support that HEC has given to our sector, because it has been absolutely exceptional. And I think one of the things that has been absolutely clear is that the investment that our county council has made in the third sector has stood us in enormously good stead, because had that investment not been going in previously, there wouldn't have been a third sector to be able to sort of draw on during this time. Just make a few quick comments about particular things that we've found about communities who have been at risk. Certainly, I think there are particular concerns around the really truly isolated. And I make reference to Elliot's comment about the people who we don't know have not been in touch with us. And I think the third sector is ideally placed to try and sort of reach those people now on behalf of health and social care. We are aware of individuals who have stopped accessing health services because of fear and concern. And that means that the levels of additional needs have been growing. I mean, again, speaking from personal experience, I'm very aware of the increased sarcopenia, muscle wasting that's occurred amongst older people who are becoming very deconditioned. But actually, I think that that is true for many people who are clinically extremely vulnerable and have been self-isolating. Colleagues in the sector are very concerned about the additional family issues that are occurring. And I think something we need to watch is, whilst we look at people as different groups, we may not be really addressing those family concerns. I know that there are a lot of children who are still not back in education now. And of course, very sadly, they tend to be the children of families who are particularly struggling. Financial crisis is becoming more of an issue. That's definitely coming to the fore. So we need to really work proactively there. And of course, referring back to Mrs. Barr's comment at the start, the impact on carers is very significant, and we're doing our best to try and support. So in terms of the pressing issues for 2021, financial viability and sustainability for a lot of organisations in our sector is crucial, partly because we haven't been able to, those organisations that rely on fundraising haven't been able to do that. And that, of course, is very important. But also organisations that rely on traded income haven't been able to perhaps sell their services in the way that they would have done before. I will make reference to funding from the statutory sector as well. I know that the County Council and Social Care are going to be under particular burdens financially with the extra support that they have put in. And I really do believe that the only way that we can have a sustainable VCSE sector going forward is if we have joint funding genuinely between health and social care. So I think this should be a real priority for the integrated care system. Also, I think that we need to be aware that the sector may actually need to increase its capacity, because, of course, throughout all of this crisis, needs have been growing. And I don't think we're going to be in the situation where it's enough to just rely on what we had before. I think we really are going to need to be able to increase capacity within the sector as well to be able to help. Finally, then, what should be issues for the whole of the sector? Well, let's retain our wonderful trusted relationships and openness that are developed during this time. Partnership has been fantastic, and it's made such a difference to the way that we work. And for third sector organisations, having trust put in us to provide the right services to the right people at the right time is crucial. I do not believe that you can detail exactly what services should be provided from our sector. I think we have to have that agility and flexibility to be able to respond to need, but that comes from trust, and that certainly happened during the crisis and should be retained. And then, of course, the thing I always mention, which I think is so important, is around prevention. And again, how we can have those conversations for the priorities of the Health and Wellbeing Board, for the whole integrated system, so that the VCSE can really make sure that our services are well aligned, so that we can carry on providing the preventative support that is so important. So can I also just say thank you to everyone for the very kind reference that you've made to the work of our sector. We have worked extremely hard, but we have really enjoyed the additional opportunities to work together that the crisis has provided.
Thank you, Sarah. Tour de force, I do nothing less. Picking up on your point about VCS joint funding, absolutely spot on. I was in a meeting yesterday with East and North in chairs in terms of the health sector up there, and there is a commitment around funding for the VCS, and there absolutely has to be. It has to follow from the primary care networks, and perhaps Prague or Nicholas might want to pick up on that. They're going to be speaking next. But thank you, Sarah, for highlighting that. the joint work, the partnership work, but also recognizing that flexibility, the trust, and actually you guys need to be let to do your thing, and it's not all prescribed through commissioning. Absolutely get all of that. That's really helpful. Thank you. Further conversations to be had, and funding key to all of that. Thank you. I'd like to invite Prague, please, to come in next.
Thanks, Richard. I just thought I'd give a perspective from a GP point of view of what's been happening. Firstly, I'd like to thank the public and our patients for their patience during this pandemic. I'd like to reiterate that general practice is open and has been open for business. Yeah. So unfortunately, the way we are seeing and patients has had to change because of the pandemic. So most of us are triaging patients first, and face-to-face consults are still happening depending on need. We've also encouraged patients to use e-consults, and I must say that has been extremely successful. In fact, our oldest patient using an e-consult is 100 years old. So that's brilliant from that point of view. There's a few other things. Patients are becoming a little bit more frustrated because of, they're not used to this new way. And for lots of other reasons, they're on waiting lists and have been on waiting lists for long periods of time. And that's frustrating. The way the hospitals are working are different, the way we are working are different. So it's a lot to take on for patients. In terms of workforce, I think lots of people alluded to this, and the workforce challenges are the same for us. We also had a couple of practices that had to shut because of COVID. Practices that have the same capacity, have same staff complement, have reduced capacity because of the longer time it's taking to see patients. In terms of mental health, Tom has already mentioned, actually mental health is the demand for low-level mental health issues is incredible in primary care now, and especially kids. And I must thank Jane for approving and agreeing for PCNs to get on and employ additional mental health workers to support primary care now. And that's been useful. And in terms of demand continues to increase in primary care. We're getting a lot of worried, and also we have more patients that are being kept in the community that then end up in general practice. And also the way the hospitals have now worked in terms of doing more remote consults. Some of the work that was done in hospital, now the pre-workup for appointments all coming to general practice. So general practice is incredibly busy at the moment. And we also have the added problem of long COVID, and that's creating more demand. So I'm sure that the system throughout is under pressure, and we got to support each other in tackling this going forward. So I'm sure Nicholas will add a few more things. I may have already overlapped on what he was going to say, but thanks, Richard.
Prague, another frontline perspective, that's really important. And again, picking up the demand there, particularly in young people, for community, relatively low-level support, therapeutic support for those with mental health issues. I understand that. That's appreciated. Nicholas.
Sorry, Richard, one more. I just want to say thanks to Health Watch, because they did a survey of about 667 patients. And which was useful because it gave us some things to actually tackle about websites and making sure practices had their website. So thank you to Health Watch for that.
Thank you for that. I did see that as well, which was a review of websites and the information around COVID and any other services that GP practices offered. So thank you, Pro. That's really appreciated, and great feedback for Steve and the organisation of Healthwatch. Thank you. And Nicholas.
Yeah, so first of all, I think, I would echo everything that Prague has said. I'd just like to add a few little extra points, please. I think the first one is, which Prague has started discussing, is that general practice is now holding a lot of presentations that, through no fault of anybody, have been delayed in terms of actually helping them. So we're dealing with a lot of people with chronic pain. We're dealing with a lot of people who, although they're actually getting help now from mental health colleagues, are still needing primary care support. And the big ask of primary care during this crisis has been to not only deal with the care of people who present on a daily basis, and that is now at about 10 to 20% above pre-pandemic levels for an equivalent time of year. So that's very significant. But we're also delivering on the flu immunisations, on now planning for the COVID vaccinations, and also the hot hubs, the way in which people can access not going to a hospital to actually get a diagnosis and care if they are a suspected COVID case. So this has an enormous impact on GPs' ability to deal with everything. And we do have, I think it would be fair to say, a very tired workforce and levels of sickness that I think are related to that. I would also like to just make a big point of thanking Sarah and the voluntary sector. I know she's talking on behalf of everybody. I think that the leaflet that was sent to people's homes in Hertfordshire was actually really useful, and I think I got to hear about its delivery within 2 or 3 days from various people across Hertfordshire. So clearly there is a need for written information as much as there is for digital information. And I would highlight some of the risks, I think, in the system. I think we have a group of people who feel digitally excluded. I know that we're doing some work on that, but I think we need to really push on that because that is a group that we need to really make sure is being cared for. I think that we also need to strengthen the work between the voluntary sector and the PCNs. And we have a golden opportunity with COVID vaccination planning to really bring that together. This could be the moment that our ICPs in both West Hertfordshire and East and North Hertfordshire actually come to life in terms of bringing together our communities. And I suppose the final thing to say is, we are dealing with increasingly frail people. There is a tsunami of children's needs and mental health and of financial problems. And I think all of that is something that we really need to concentrate on. I will stop at that point, but I think, that's something over and above what Prague has said.
Nicholas and Prague, it is quite obvious that frontline primary care GP practice is as under strain as anywhere else in the system, and we recognise that. And again, thinking back on Sarah's point about joined up working, you've referred to it again, that how does the primary care network refer back into GP practice, but also back out, and how do we fund that VCS to be able to receive that referral out of practice?
Yeah, and if I may, Richard, just one final thing, actually, just which occurs to me, is that partnership with our acute trust, with our community provider over in West CLCH, as well as all the other people I've mentioned, has been incredibly important. So I think everybody is really taking that partnership that we are going to talk about maybe a bit later in terms of some of the changes that are going to be happening in terms of health and social care structures. I think this is a great preparation for that. A horrible way to have to do it, but really a great opportunity.
There we are. Thank you, Nicholas. And now Richard Cassidy, before I bring in Jim. Thank you, Richard.
Thank you, Chairman. Apologies for being late to the meeting. I'm Richard Cassidy. I'm the Chief Executive at East Herts Council. I'm representing the Hertfordshire Chief Execs Coordinating Group. I think there's some common themes here, aren't there, particularly around how well organisations are collaborating. And certainly, I think from a district authority's point of view, I think there's been a very clear role for local authorities to act as sort of coordinators on the ground in terms of delivery of schemes that have different flavours in different areas, particularly in terms of, for instance, the town centre coordination, either whether it's shop local campaigns or working with the police around COVID enforcement or supporting county council traffic management. There's been really good on the ground working in terms of deployment of the various things we've had to do to manage COVID. I think one of the things we haven't mentioned particularly that I think will have a significant impact is the economy coming out into our recovery stage. Certainly as furlough tends to drop out, unemployment is already rising significantly across Hertfordshire, which is something that we're not particularly perhaps used to in this area. There's significant calls to housing teams in terms of increased concerns around particularly people living in private rented accommodation around becoming homeless. Leisure, hospitality, tourism industry has been very hard hit, and also some of the major employers. So, for instance, East Herts, you may be surprised to learn our largest employer is in fact Stansted Airport out of the district. But again, some of those industries will take many years to recover fully from the impact of COVID, and it's understanding the impact on the lowering of the economic standard, if you like, in the area will have on public health issues. I think may be quite significant. Just a quick mention of the Community Reassurance Cell, which is one of the cells that exists under the Local Resilience Forum. Unusually, that cell is led by democratic elected leaders of local authorities and other senior members. And again, I think it's really good that in Hertfordshire, I think uniquely, we have members plugged into the work of the LRF around recovery. And that cell's been looking at things around providing reassurance and messages to public over some of the key COVID messages we've had to put out. So the Play Your Part campaign in terms of wearing masks, a Travel with Confidence scheme in terms of people using taxis, championing the BAME, Black and Minority Ethnic work around ensuring that the BAME community is protected. So again, a mention for that cell. But I think in terms of overall comments in terms of where we are in reflections, from a sort of systems leadership hat, I think there are three things that really strike me that I think we have sort of touched upon. I think the first one is that our capacity for change is much stronger than we thought. And we really have, as organisations, moved quickly. We've shown that we can be flexible and we can mobilise to do things differently very fast. And I think that's credit to leadership across the system and the way we've all worked together in the range of forums. And I think the last thing probably is around, I suppose, the new normal and how agile working and transformation has been forced upon us. But actually, there are some silver linings and things coming out of that we probably need to make sure that we engage with. I suppose the three concepts there, work is what you do, not where you do it. So that's led to customer self-service and digital engagement being maximised over the COVID period, and we need to sort of keep hold of that. But also very much about how all organisations use the new IT and technology solutions that we found. We're on a new technology solution now to underpin our collaboration and communication going forward, because there are some significant efficiencies and cost savings in working differently. And I think all organisations need to make sure that we are maximising those opportunities. And perhaps just a final question for me is, the other thing I was really struck by through the COVID, particularly the initial COVID wave, was how many people have come forward, if you like, to volunteer and play their part in terms of strengthening the community. And so I think a major question is, how do we keep that momentum going during the recovery phase, that people who want to volunteer and play their part can continue to do so?
Thank you, Richard. That's I think I'm going to reflect on that. I think we all should. Our capacity for change is stronger than we thought. That is that's almost profound, Richard. So just go and lie down. You're going to have a rest now. That's really thought-provoking. There are volunteers right now packing little parcels, Christmas presents, acts of kindness, and that's volunteers that came forward because they want to make a difference. And we've got charities and organised and individuals doing that and offering that support even now. And they started back in March. We had more than 10,000 volunteers come through, of which about 6,000 or 7,000 found a meaningful role during the pandemic, and some are still with us. That is fantastic. Big shout out for Decorum. They managed to find nearly 100% of utilisation for the volunteers. So everybody else, you can catch up. Thank you very much. Cool. I would just like to Jim, I think is going to round us off now. I don't think I've got any other speakers. So Jim, over to you. Thanks again, Richard.
Thank you, Chair. No small feat. I
am just going to bring, my apologies, Jim. I will bring in Ed at the end of this to just bring it a further conclusion, but my apologies, Jim.
No worries. Thank you. To address a specific point, if Nicholas and members think we should do another leaflet, then I'm happy to kind of work on that. And because Nicholas is right about exclusion. And I think what we have shown is that we can work in systems in Hertfordshire, and keeping those skills going, echoing Richard's point about our capacity for change is greater than we thought, is going to be crucial for the future about working on recovery and working on inequalities. And I think if I may look forward, I think there are several things we have to do. Tim has already said that he wants a new health inequalities strategy for us in terms of addressing inequalities going forward, because that's going to be key in recovery. And work on our BAME communities is really going to have to step up. Work on grief is going to have to be a part of that. Work on mental health we've already discussed, but needs to work on. We need to work on that. But Sarah has also reminded us of the need to prevent avoidable physical ill health and avoidable disability and deterioration. And I know Sarah's working on some healthy ageing proposals, but we need more. And dental health, I think, needs to be in that. So I think for the next 5 years, we are going to be picking up the pieces. And that gives us an opportunity to focus on recovery more than anything else. So I want to use this as an opportunity to say we need some ideas of projects and programs to take forward. The way that the voluntary sector stood up, the way that District Council Environmental Health stood up to single out but 2 people has been astonishing. And, you know, our environmental health teams have been unbelievable. And I mean, I know I've been working 13-hour days, but so have many other people. So in looking forward now, let's think about what we can do on inequalities, BAME populations, grief, mental health, and the prevention of avoidable physical ill health and dental health. And let's talk about what more we need to do, because I think we need to start now, just as we started for planning in winter in August. We need to start now for planning for recovery and exit. And the work Rich has been doing has been quite crucial on that.
Okay, thank you, Jim. I think it's really interesting that COVID is asking us to really look at the fundamentals of how we live our lives and how we are resilient to the changes that come at us quicker and faster than ever before. And good physical health and fitness and mental well-being and being able to cope with that change. The dental health is in that mix as well. This is fairly basic to how we live our lives. And I think that's really, really important. And I hope both in our own departmental and agency practice, we think that through for your new strategies. I love the idea to bring a new health and inequality strategy through Tim and his work, but also that must feed into a new health and wellbeing strategy, which brings me segue neatly into Paul's point from earlier around the NHSEI proposals on what the ICS might look like in the future in terms of a legislative programme and a consultation that will end on January the 8th, which we need to respond to. And there's some really clear guidance have come out now It's been updated last week. It's changed already, but it has been updated. One of the things I picked out of there is that for the first time, place has been defined in terms of relationship with health as an upper tier county area. And I think that has never been a part of those proposals in the past. And I think that's something we will need to reflect on. I don't think we need to debate on it now, but it is certainly something that we need to reflect on as in terms of influencing how we want that really joined up, integrated health, social care, full sector, everybody around this table now, how we want that to represent the place of Hertfordshire. Thank you so much. Ed, did you want to come in and add anything more?
I wasn't just intending to add a huge amount more, Chair, just to capture, for both minutes' sake and for the sake of closing off the conversation, both some of the key points raised, certainly kind of the overlaps between a lot of what we've heard, but also a quick summary as to some of the observations and as to what that might mean for the work of this board over the course of 2021. So I will be brief. I recognise I'm coming to the 2-hour slot, and I also recognise I'm repeating back to you issues which you yourselves have raised. But I suppose just to start off in terms of that element about partnership work, I suppose clearly no one is unaware of it or forgetting it, but I also think we mustn't become complacent about it over the course of 2021 as the world becomes busier and the demands on our organisations are perhaps even more pressing and more diverse. I think we probably also ought to reflect on our role as the Health and Wellbeing Board in terms of creating that environment for partnership working. It's not just this board's responsibility or this board's product, but certainly we are part and parcel of what makes that partnership infrastructure and architecture, which allowed some of this to happen. And just that recognition that partnership work does take time and effort. So in addition to all the stuff we're doing right now, we need to find a way to continue to resource that over the course of 2021. I suppose another observation is that compared to a usual Health and Wellbeing Board paper or agenda, what this item just obviously illustrates is just the sheer breadth of activity that's represented around this table, and just the sheer scale of interdependencies that now exist across our organisations. It is very much not the situation of the County Council and its social care responsibility speaking to the NHS. All of our sectors and all of our organisations are very much now interlinked, perhaps even more so now than they were at the start of the year. Just to reflect on all of the references that people have made to our staff, again, that staffing doesn't necessarily always come up at a Health and Wellbeing Board, but it absolutely has done so, and correctly so today, including our school staff, both in terms of their flexibility and our shared concern as to how long people can continue to operate at this tempo and under this level of pressure and anxiety. Just to capture some of the service perspectives we've heard, so key points raised by Tom and Prague and Nicholas, for example, around not just the volume of activity, but also the increased acuity, so the increased level of need we're seeing, and all of that compounded by the issues which I know both Elliot and Sarah referenced in terms of those people who perhaps should have accessed services but haven't, and what we need to do is, of course, from Steve about complementing our observations with the observations and the insight from our service users and the people who are actually using those services right now or choosing not to use those services right now. So just looking ahead, I mean, just as I run through the list of things I've heard in terms of where we need to concentrate our attention, and there may be too many for us to do over the course of 4 or 5 health and wellbeing meetings. So we'll just need to think about how best we work across these. We obviously have and have done so across many of these health and wellbeing board meetings this year, talked about the mental health and psychosocial impact, and that's clearly unavoidable and something which we will have to collectively look to address across our communities. That long tail of people not presenting or presenting later, and particularly how do we make sure that we learn the lessons of this pandemic and that our approach to how we tackle that tail doesn't exacerbate inequalities, or at least tackles inequalities that COVID-19 has highlighted. How we make sure we're continuing to hear at this board from our staff and from people accessing services. So going back to Steve's point around the kind of input of Health Watch, the viability and sustainability of the voluntary sector, including Sarah's point around joint funding across both health and social care, and the opportunity to strengthen the connection between primary care and the VCSE. Jim's references and Tim's references to the inequality strategy, to our need to focus on what we now know about the impact on BAME communities, and the other strategies that Jim mentioned, including kind of focuses on dental health and other areas. Last four, I promise. Impact of the economic downturn. So Jenny referenced the family poverty strategy. My question would be, as a partnership, and to be honest, as public services at the moment, are we primed to address some of the issues we're likely to see as a consequence of the economic downturn? I imagine we'll be seeing some issues that we haven't had to deal with for many, many years, and probably haven't had to turn our attention to for many years. So how are we making sure that we as a partnership are best placed and geared up to tackle some of these issues that we perhaps wouldn't have had to deal with previously? And finally, in terms of this board itself, how do we continue, in light of all of that, to provide the space, the environment and leadership for partnership working? And how do we make sure that our response and focus in 2021 is as coordinated and as reciprocal as our response to the pandemic has been over the course of 2020? And I'll leave it there, Chair.
Ed, that's really helpful. I mean, you've virtually written half the strategy, and well, you had a lot of help there from the previous speakers, I have to say. But we've got some serious programs of work there, which are addressing both post-COVID and actually a changed world. And I suppose what I would say is that collectively, there is a significant input at the moment into supporting the well-being of our residents. And the question you quite rightly ask is, have we got that focused as well as we should? We've got probably 18 months to 2 years to do this work, and it's going to be really important. So the additional support we've got in for the Money Advice Unit, for example, and CAB is really useful. The closer working with the VCS, which has been supported, that is really useful. But I do think you're right. We need this probably a bigger, stronger package, certainly running into next year, that will get us get that additional support into the community where it's going to be needed big time. Thank you very much. Really helpful. I'm just minded, we've been going for 2 hours. There is only one more agenda item, but I am going to suggest that we have a 5-minute break. Just to get away from your screens, and then we will do the children's and adults safeguarding reports. They probably won't take that long, but let's just give ourselves 5 minutes. See you in 5. Thank you. Bye. Colleagues, thank you. We are back live, and sorry to put that 5-minute break in, but I thought it was useful. We only have one more agenda item left, and that is the annual report of both the Adult Safeguarding Board and the Children's Safeguarding Board. It is a statutory function. They come before us so that we understand how safeguarding has been in the last year. These reports are for noting. I would like Liz Hanlon, who's the independent chair of the Adult Safeguarding Board, to present her report first, and then followed by Jenny Cole, Director of Children's Services, and Matt Ansell is briefly going to take us through the neglect strategy that flows from the work of the Children's Safeguarding Board. Thank you so very much. Elizabeth, over to you.
Thank you. Good afternoon, everyone. So I've just come to present the Safeguarding Adults Board annual report. I'm going to work on the proviso. This has gone out to everybody and everyone's read it. So I'm just going to pull out a few highlighted points from the report. The report that you sent to you, it covers the period of the 1st of April 2019 to the 31st of March 2020. And this year's report is a slimmed down version of our full report, and that's due to COVID. And it was agreed that we would present a slimmed down version this year. So just to pull out a few of the campaigns and policies that took place through the board, we completed World Elder Abuse Week, where that was multi-agency, and campaigns and presentations were presented along all agencies. Financial abuse and scamming has been highlighted throughout the year, and actually that's been particularly prevalent through COVID, and we've done quite a lot of work in relation to scamming through the COVID. Self-neglect and complex cases, these result from safeguarding adult reviews where adults with complex needs have been subject to abuse, and we presented to the board a complex case strategy and policy which has been adapted and identified by all agencies. We've completed a multi-agency pressure sore policy, which again has been signed off by all agencies on the board and is being used. Medication error policy has been signed off by board, and again that has worked really well during COVID. Safeguarding supervision principles has been signed off and presented multi-agency throughout partner agencies. We've also carried out a training needs assessment, and as a result of that pulled together all the needs of all professionals, multi-agency, and put together safeguarding packages, which actually we have still completed during COVID, but we've done it online, and actually that's worked very well. And we've also presented a conference on adults with learning difficulties, which was very well attended. We had over 150 people attending from different agencies. Continuation of agencies with self-assessments. So we still carried out self-assessments across all agencies on the board and the wider professionals, including all 10 districts. And we worked with the Children's Board in relation to transitional safeguarding, and that's a piece of work that is still continuing this year. Towards the end of March, we carried out, there was one safeguarding adult review in progress and 2 multi-agency reviews. One safeguarding adult review has been published, which is in relation to a young lady called Josanne. Josanne, and it's reported within the report, is a young lady, disabled lady, who unfortunately passed away in hospital waiting for a peg change, a feeding tube change whilst in hospital. There's been quite a few recommendations came out of that safeguarding adult review, which was accepted by the board and agencies. That has now been published, and an action plan has been pulled out of those recommendations and are being presented to the board and being monitored by the subgroup and the board. For the future, for this forthcoming year, we're working on the serious and violence crime strategy, which is joint through the county community unit, and that is for a lot of boards involved in that. The adult boards specifically are looking at cuckooing, and we did our first forum yesterday in relation to cuckooing. We've got another forum in January, and we're looking at putting together multi-agency practice in relation to cuckooing, also linking in with modern slavery. Self-neglect policy, again, out of 3 of the safeguarding adult reviews we're working on were either alcohol or drug dependency. So we're looking at continuing with self-neglect complex cases involving adults with alcohol dependency. All the learnings from SARS, as I said, have been put into action plans and being updated by the board. We're monitoring the recovery plans from all agencies in relation to COVID. Just to touch on within the review, we have mentioned COVID pandemic because, of course, we have to. So the board has been continuing throughout the pandemic. All statutory partners have met fortnightly online, where we've discussed contingency planning and any threat, risks and harms, multi-agency in relation to safeguarding adults. Safeguarding adult reviews have continued throughout COVID. We've increased our focus on scamming, domestic abuse, support for carers and support for care homes. And we've been involved, as I'm sure you're aware, with the care home review that the board carried out. And we're looking at the safety and care for adults with disability and working well with the care home cell project. So even though the annual report reflects the year prior, so it ends in March, we have added certain bits in relation to the pandemic and the work that the board's carrying out throughout that time.
That's really helpful, Liz. Thank you so much. I wonder if I tell you what we'll do is if we take Jenny, if we take your report now, and then we can see if there are any questions arising. I think that would be and in fact, what we'll do is Jenny, you give us a children's report. Matt can present the neglect strategy, and then we'll go for a question and comment. Thank you.
Yes, okay, thank you. Again, like Liz has said, this is the annual report for the Children's Safeguarding Partnership for 1920. And this was the first year of new arrangements that were brought in across the country, where the change was that 3 responsible partners of equal level, if that's the right word, were identified, the local authority, now the ICS, and the constabulary. And Hertfordshire embraced those changes. We became an early adopter. We saw it was a good time to review what we were doing. And as the report says, we streamlined our policy groups and had a real focus on continual improvement and learning. On the priorities for the year, and actually they've moved into this year as well, are neglect, and we'll pick up on that. Matt will talk about the work we're doing there, vulnerable adolescents, particularly around exploitation, and as I said, continuous improvement and in learning, and then running all through that diversity and inclusion, which again is a priority for this year. To remind the board and any members of the public listening, the Hertfordshire Safeguarding Children Partnership plays an important role in coordination and ensuring effectiveness of what is done by agencies across the partnership, and to enhance our scrutiny of what goes on in the partnership. We no longer have an independent chair, and I had the privilege to chair the partnership last year. Partnership this year is being chaired by Bill Jefferson, Assistant Chief Constable. But what we do have is an independent scrutineer who happens to be who used to be our independent chair. And you'll see in the report that that scrutiny role gives us the capacity to do some really quite deep work. And we've looked at contextual safeguarding and exploitation, gangs and county lines across the county, children who find themselves in custody suites at the police station as a result of youth offending activity, and also child protection medicals. And the scrutiny role picks up on a whole range of research and evidence, and that informs our learning and our training. And we a positive that has come out of the challenging times around the pandemic is that we are now able to offer, as are the Adults Board, a whole range of online training, which will really take off next year. But we have our learning hubs, which are local. All practitioners can attend, and we've continued to focus on key areas for Hertfordshire in those, and neglect is one of them, hence the focus going forward. So I don't think I'll say any more than that, other than to confirm we do link with other partnerships, particularly the Domestic Abuse Partnership and the Criminal Justice Board, as well as obviously the Adult Safeguarding Board. And as you can see, we have a joint training group with the Adult Safeguarding Board. So I think that's it from me, and I'll take any questions. Matt, would you like to say about the work we're doing around neglect?
Thank you, Jenny.
Thank you, Jenny. Yes, thank you for this opportunity to come and talk briefly about our neglect strategy. As Jenny said, neglect was one of the priorities of the Safeguarding Partnership for us to renew our strategy, but also look at how we could really make a difference for children and young people's lives in Hertfordshire. What we know about neglect is it's the most common form of abuse that we see in children that are subject to child protection plans, both in Hertfordshire and in the country. And the strategy that we're developing has been informed by a range of different forums. The Safeguarding Partnership have stakeholder groups, but we also have practitioner-led forums. And so we've used all that information to help us inform how we were going to take the strategy forward and what the priorities would be within that strategy. And what our strategy really is aiming to do is to sort of reduce the need for statutory intervention in children's lives and provide support and intervention and education around neglect at the earliest possible opportunity in their lives. The strategy has 4 key aims. It's an ambitious strategy. We want to eradicate, and we aim to eradicate neglect for all children and young people in Hertfordshire. It wants to be a strategy that we embed in very much our early years and our early help agendas. And we want to make sure that there's a focus on neglect for children that come from all backgrounds, regardless of social class and financial standing. So a recognition that neglect can happen in all families. And a focus upon neglect for older children, so not just young children, but also children in teenage years, and the impact that neglect can have in them in terms of other concerns, particularly around contextual safeguarding and exploitation. So in terms of how we've taken this forward, we've developed a partnership with the NSPCC. So that's been a really a good piece of work for the partnership, and the NSPCC bring a wealth of knowledge and expertise from all their work with different local authorities and different partners around the country. We made an announcement about that partnership on a World Children's Day, which is on the 20th of November. So there was some communications that went out around Hertfordshire and on our online platforms. And we're looking to undertake a formal launch in February 2021. There's going to be 3 phases of that campaign, and very much a community focus. We'll be running it throughout all the phases, so looking to really provide education and how you can have families and parents can access resources in their communities. And then a professional focus, which will really be looking at what training we need to provide to all professionals that work with children and young people and families, so to enable them to, when they are working with families at that earliest opportunity, to feel confident to provide interventions and support for families right at the very beginning of any issues or concerns around neglect. Okay. And then the third part of the strategy is really sort of doing some engagement work with children and young people in Hertfordshire. So making sure we do education for children and young people, but also engaging them and making sure we're hearing their voice. And then we're developing a framework to measure the outcome and impact of this strategy. And we're going to link that to our outcome Bs, which hopefully people are aware of, in terms of really looking at the key impacts that we want to have on children and young people in Hertfordshire. And I'll take any questions.
Okay, Matt, Jenny, thank you. I mean, thank you for letting us know how you plan to tackle neglect. That's really helpful, and I wish you well. And I'm sure you'll be reporting back through Teresa's panel on success there. Just picking up one stat from your children's report: 421 children with a child protection plan. When I was portfolio holder for children, at one point we were well over 1,000 for quite some time. That is an incredible achievement, and congratulations. And to Liz and the Adult Safeguarding Board, using the work of the tragic death of Jazan, and highlighting how that's influencing new practice is also just what we want to hear here at the board. Thank you. Are there any comments? Or I realise that this paper has been to a number of other panels and boards already. So if there aren't many comments, I would understand that. Any questions to Matt, Jenny, or Liz? No, in which case that leads me to Liz. Thank you so much for your work this year. Jenny, the Safeguarding Board under its new arrangements, and Matt, all the very best with the neglect strategy. Really appreciated. Thank you. That does bring us to the end of today's meeting. I am delighted that we have done that in 2.5 hours. And I've just been reminded by Elaine that we have to vote to note, quite right too, this particular item. So on the Children's and Adults Safeguarding Board reports, thank you very much. And that has overwhelmingly been noted and agreed. Thank you very much indeed. So that just leads me to thank you for a fulsome update on where we are with COVID, where your agencies are. It's given us a real feel for what the challenges are, both now, currently, and will be next year. And again, so thank you, Ed, for drawing some of that together, and will help influence our work next year. I look forward to really building on that partnership work and the strength of it, which has been outlined by so many of you today. And I think going into the festive season, Hertfordshire is stronger as a result of what you've been doing this year, and I commend you for it. Thank you so much. Thank you. We'll meet up in the new year. Bye-bye for now.